Hello and welcome to the World Extreme Medicine Podcast. I'm your host, Stephen Wood. I'm an EM and critical care NP and medic, podcast host, and wilderness enthusiast. It's great to have you joining us today. We know there are a lot of podcasts you could be listening to. There's a lot you could be doing with your time. We're thrilled that you're spending your time with us today on the World Extreme Medicine Podcast. I'm very excited today to have two great guests for the price of one, although they haven't sent me their bill yet, so I'm just assuming it's the price of one. But I'd like to bring on board and welcome Dr. Liz Yates and Dr. Louis Nguyen from the Department of Surgery at the Brigham and Women's Hospital in Boston. So let's meet our guests. Dr. Yates, can you give us a little bit of background on what you do and your work?
Absolutely. I'm a general surgery resident at the Brigham, as you mentioned. I finished 3 of my clinical years so far, which means I still have 2 to go. But in between our clinical years, we're allowed to take an academic development sabbatical effectively, which is anywhere from 1 to 3 years of time to focus on research. And that can be anything from getting an extra degree to basic science research, or in my case, I've been very fortunate to be able to focus on issues around sustainability in surgery and the impact of climate change on surgical outcomes. And my research mentor in that effort has been Dr. Nguyen.
So, Dr. Nguyen, wonderful to have you on today. I love your background, by the way. You can see it looks like a nice tropical picture behind you. We're all from Boston. Right now, it feels like we're in the tropics. It's 90 degrees with about equal humidity. So this is a perfect topic to be talking about. Can you give us a little bit, of a dive into your background and experience?
Thank you, Stephen, for having us both on the podcast. Again, my name is Louis Nguyen. I'm a practicing vascular surgeon at the Brigham and Women's Hospital. I'm associate professor of surgery at Harvard Medical School. I wear a lot of different hats. And in this case, as Liz mentioned, I also have a long track record of mentoring residents and students towards academic research projects. Liz is a little unique because we do a lot of research, but also in an area that I think is not traditionally filled with researchers and projects, which is the environmental sustainability of the sector. So I've had to put some extra brain power into this, but mentorship for Liz has been great. And we've used some of my teachings from academic research and behavioral health and behavioral economics to add a little twist to sustainability projects, which we'll hopefully talk about later this hour.
Oh, great. Well, I think what I'd like to lead off with is just kind of a generalization. When we think about climate change, we think about sustainability in the environment and medicine, a lot of people think about, maybe heat islands and that impact. But we don't think about kind of, sustainability. We don't think about, kind of what people consider pollution. We tend to think about those of the, that's the realm of heavy industry and transportation. And we don't think about, this as much, I think, in our healthcare setting. It doesn't immediately jump to mind as being a problem in and around healthcare. So can either of you and actually both of you kind of lead us into what's the connection there? How does healthcare impact the environment, and what's the impact of that environmental change on healthcare and healthcare outcomes?
It's a really important question, and one that we deal with pretty frequently in our work. The most recent estimate and kind of best estimate out there is that healthcare has a pretty big what we call carbon footprint, meaning that the daily functions of the healthcare system, be it making pharmaceutical drugs, running a hospital, having patients come to clinic, the footprint or the carbon emissions associated with that total industry actually add up to quite a bit. And the most recent and kind of best estimate out there is that we're approximately 9% of the total emissions in the United States. That's on the higher end of healthcare industries across the world, but we're not surprised because the US healthcare industry as a total of our economy is, as we all know, bigger than other kind of equivalent nations and certainly larger than some of the developing countries. So when we back out and look at it on a global scale, healthcare actually represents almost 5% of total carbon emissions across the world. And it may sound like a small number, but 5% is actually many, many gigatons or millions of tons of carbon in the atmosphere. And so the way that we practice and the way that we deliver care actually does impact climate change. And as we'll talk about a little bit more this hour, it actually downstream has effects on our patients' health.
And I'll just add that, I kind of represent the average person, someone who's not totally into environmental information and so forth. And this fact of the healthcare impact struck me foremost as I was, working with Liz to develop a research plan. We don't think of it. I think about, as you said, cars, industry, a lot of other things. And we realize that our industry of healthcare is impacting this situation as well. So I think a part of it is being aware of it, and most average physicians and so forth are not aware.
Yeah, I was thinking about it today as I went to work because knowing that we were going to have this discussion today, and the entrance that I used is near the power plant for the hospital, which is about the same size as the hospital, and we don't think about that, and you never really think about the power plant of a hospital unless you're looking for it specifically. The footprint is about the same, and similarly, just thinking about just at the very basic level, the amount of waste today in and out of the ICU, how many gowns I took on and off, how many masks I threw away, all the stuff that I threw away out of a central venous line kit, and that we do every day. Open up all these kits that's plastic and disposables. And we've really, I think, become an incredibly wasteful industry at kind of every level. And I'm very thankful that there are, providers out there like you that are, making that connection. It makes sense that our healthcare workforce should care and should think about, these issues. I'm not sure we do as much as, people like yourself do. But how do we make it relevant for people that are outside of the healthcare industry, be it people that are making, these disposables, or how should our patients be thinking about, what the impact of healthcare's contribution to, this waste is? And I'll call on Dr. Nguyen first. I'll give you the first shot at this one this time.
Thank you, Steve. So I think it's severalfold. You're right. Awareness is one thing. And we certainly recognize that patients who come to the hospital, the last thing they're worried about their health, and the last thing they want to, think about is the hospital being wasteful as they prepare my surgery. So we totally understand that. We're being realistic about that. But it also turns out that the environment affects health in other ways besides just smog. And we talk about heat and heat waves. We talk about the impact of cooling and recovery from surgery and so forth. So it really is an eye opener in the way that these things affect it. But our approach to it is that patient care comes first. We don't want to divert everyone's busy focus on patient care. But when you do have a moment to step back, there are systems and processes that we can put in place that can affect patients.
Yeah, I totally second everything Dr. Nguyen just said. I think the way his, especially background in behavioral economics, has helped us shape our projects and our research has been really to focus on the fact that patient care and the utmost best patient care we can provide is priority number one. But the reason it's so important that the healthcare industry and healthcare providers get involved in this work is to ensure that the solutions that come forth, which because of the way the economy is heading and various regulations coming down at both the state and federal level, where our industry will ultimately be forced to kind of get on board with an increasingly sustainable practice. But we need to make sure as providers that we align those goals with our clinical practice, that it's not on our shoulders to constantly carry the burden of trying to be documenting everything, doing best patient care, and then on top of it, considering our waste, considering our energy use. Like Dr. Nguyen said, we have to design systems that work for us and work for the environment. And if I were a patient, I have been, I would want to know that my doctor isn't being distracted, as Dr. Wynn said, by these demands. And so building systems that work for both goals is so crucial.
If you don't mind, I can give some tangible examples of that. One of the things we did when our walkthrough in an initial aspect of our starting our projects was we talked to nurses and they said, you know what, we open these packages that have their devices or simple devices even, and they have all of this packaging, you know, like a booklet in every package. And we recognize that's probably regulatory and, you know, required. But if they do the same thing over and over again, those things build up and rarely are they needed to look at. And so, you know, one idea is, can we work with regulators to say, let's have a QR code, just like now when you go to restaurants and you want to look at the menu, you can do it on your phone and get the information as needed instead of generating the piece of paper and the booklet every single time, you know. So these things are, if you talk to people who do this every day and you ask them, hey, in your spare moment, think about sustainability, like, oh, here's a great idea. Why do we do this? And then it requires collaboration with industry and regulatory stuff. But these things can be done, you know, to cut waste at every level. But that's just one tangible example that we've thought of and encountered during our investigations.
Yeah, and those are important. I think we ignore a lot of the waste. We like I gave the example, you know, when you open up a tray to do a central venous line or an LP tray, just thinking of how many things you throw away and how much you use. Are there better ways to, you know, for us to speak to these people making these kits to say, this is wasteful, we don't need all these? Or could there be different ways to, you know, assemble a kit? I know we do it for ease, but then when you're throwing away half the kit, it just seems wasteful. To build on that, and this might not be something you've thought of, but, you know, especially as we're, you know, still in this pandemic, you know, and other diseases that we've treated with using plastic gowns, masks, you know, hats, shoe covers. Certainly early on in COVID, we didn't know how this was transmitted, so we weren't sure what we did or didn't need. But now with certain things like MRSA, ESBL, you know, these other diseases where we have a really good grasp on transmission, yet are still implementing these, you know, these protections that aren't necessary and that lead to significant waste. What are your thoughts on that? Do you think there's more, you know, need for better research in this area, better education? How can we impact that, you know, in a fruitful way?
I think both of those ideas that you kind of both touched on, education and research, are so crucial and key. It's really hard at one level to change a kind of traditions-long practice. And a lot of those things you're highlighting, you know, yellow gowns as you walk into an MRSA room, have been, you know, essentially law for decades. Certainly for as long as I've been a clinical resident and even during medical school. So my entire medical career thus far, I have always put on a yellow gown to walk into an MRSA room. And just like you, I have had the same thought, is this really protecting my patient? Similarly with a C. diff, if we know that the best way to prevent C. diff is to wash your hands, and yet I gown up every time. And the challenging thing there is that safety is the number one priority for both staff and for patients, and we certainly would never want to compromise that. And so starting to have those kinds of conversations around making more environmentally sustainable choices in the healthcare industry become challenging when you start to even get into the realm of safety, even if we intellectually know that that's not the way disease is transmitted. And the way we've started to tackle that is to try to take on less hot button type projects and build some success in terms of identifying sustainable changes we can make in our hospital and building some momentum and some support among clinical providers so that we can then start to have those slightly harder conversations that challenge the traditional norms, especially if they're not evidence-based. And like you said, that's kind of step one is education. But step two is really doing the implementation research and showing, you know, if we don't wear these gowns, we have the ability to track and we can show that our infection rates aren't going up. My assumption, based on all of my knowledge in terms of just being a clinical provider, is that they probably wouldn't. but I would never, compromise patient safety for that goal.
To add on that, we had a recent conversation with one of the environmental services directors about the use of these gowns and so forth during COVID. And so, of course, everyone reacted and, put, everything on. Of course, that was the right thing to do. And then once we, understood better, people were still a little reluctant to, de-escalate a lot of the gowns and throw them all into the red bags. And so our hospital produced lots more red bag waste during the COVID era. Again, people understood. But then when you looked at the cost and the waste, and we realized that wasn't, sustainable. So people backed off and their comfort levels were okay with that. And the other big thing was our HVAC system. So we generated special rooms with negative flow so that the vapors would stay inside the rooms. But we realized that no one else was doing that, and that was not necessary. And so eventually, through a lot of, checks and so forth, we backed off that. So a part of it is, as Liz said, breaking tradition or re-examining tradition. And a part of it is sort of making people comfortable because that's all they know, and so through evidence, research, changes in practices, all the safety checks, we can do it. Even the harder things.
Right. It's a lot of conversation and
Yes.
a lot of data to really that we either have to provide upfront or spend the energy, moving forward to demonstrate that those outcomes, are either unchanged or it's safe practice. But it's a lot of work to convince, multiple structures of individuals, from administrators to healthcare providers to, as you mentioned, the service industry that are cleaning those rooms and maintaining those rooms. So to build on that, as surgeons, how have you structured these kind of discussions specifically with your surgical colleagues, and how have you framed these discussions specifically with your surgical colleagues?
Maybe I'll start, Liz.
Yeah.
And to me, again, as the older senior surgeon of the group, I feel like, everyone is focused on patient care, of course, and safety and so forth. So if we just say, just do it because it's better for the environment, again, it's just my perspective. I don't think that gets enough traction. For some people, yes, totally, that's the right thing to do. I'm willing to sacrifice. I'm willing to change. But for most people who are busy, whether physicians, nurses, and so forth, I think there has to be something else in it. Again, that's just my personal opinion. And then some of it is cost. So if you're an administrator, cost is a big thing. Long-term cost savings would be one. Number two would be sort of the environmental impacts in the long term. Again, that could persuade people to do it. And our approach is, well, if we made it easier for you to make these changes and these choices subconsciously, and there would be, of course, an environmental impact, would you do it? And most people would do it. They realize that just by convenience, they'll do it, and it'll be the right choice. And so that's where the choice architecture that comes from behavioral economics comes into play. And so we just don't say, this is the right thing, you morally have to do it, or you're a terrible person. That doesn't work. Or you must do it because I'm demanding you do it. That's not really positive. So we sort of do these really clever things from behavioral economics to change the choice architecture, and people are actually doing it, and they're willing to do it. And I have fun examples of behavioral economics, but we can talk about it. But let's listen to Liz and her response to you.
Yeah, I've spent the past, full academic research year trying to convince surgeons to care about climate change and sustainability. And my pitch is pretty consistently the same. And as Dr. Nguyen highlights, you can target different aspects and different benefits of a sustainable approach to healthcare for different groups of people. Like you said, especially for administrators, cost. The bottom line is going to be a big issue. And there's a fair amount of data to suggest that there are ways to align those goals, sustainability and cost savings. But when I talk to surgeons specifically, I've actually found it's a little bit more easy to make the connection from a healthcare standpoint and from a health outcome standpoint than I expected. It's, in my mind, a two-way street. Our clinical practice, and especially delivery of surgical care, which is highly wasteful and incredibly energy intensive, has a carbon footprint. We impact the environment. And on the flip side, we're starting to see with more and more data coming out, particularly from OBGYN and cardiovascular literature and on asthma, that how we impact our environment affects our patients' health. And we can't ignore that. And so from that standpoint, we have an actual role in improving the environment in order to improve our own outcomes. And that kind of conversation opens a lot of doors with surgical practitioners, because I can tangibly say, hey, look at all this waste we're making in the OR, or turn to the anesthesiologist and say, hey, did you know that your anesthetic gases go right outside into the atmosphere and that they are greenhouse gases? And when you think about that, that's how climate change gets perpetuated from a healthcare standpoint. We're part of the problem. And that really tends to ring a bell and start conversations, often more heated and more exciting than I anticipated. But it's been a good platform to start that kind of conversation.
And is it the
if I may also add,
sorry, go ahead, please.
All right, again. And I think surgeons respond to tangible things. So one of the projects that Liz and I are doing is this impact of heat waves on outcomes, and specifically surgical outcomes. Our hypothesis is that patients who have surgery, let's say a simple surgery or a complicated surgery, and they have a wound, and they're going home to recover, if there's a heat wave, then that recovery is going to be very difficult, from wound healing, just general comfort and recovery and so forth. And then our secondary hypothesis is that disparities, so certain populations, vulnerable populations, are more worse affected from heat, because again, they're less likely to have air conditioning or get away from some of the influences of a heat wave because they live in urban areas and so forth. So that's like a tangible example that we're trying to do research on, and to show that heat waves affects our outcomes. And so I think that's something where surgeons say, oh, okay, wow, that's something that we can understand. And to mitigate heat waves, it's purely air conditioning, so can we set up systems where we can help pay for electrical bills, or something that's changeable? We can't change disparities, we can't change race, but we can maybe help with the work with the city and other resources to get some people air conditioning, or let's offset their electricity bill so they don't feel bad about turning it on, and they have better recovery with the heat wave and their surgery.
Even considering
I'd like to be first on that list, if I can. Yeah. I have air conditioning just in one room, and I'm sitting in it now. Yeah.
And
it's a big driver for getting you to work.
Yeah. We're all, as you highlighted, Stephen, in the Boston area. And Dr. Nguyen brings up heat waves and the disparities that can be propagated because of lack of readiness and lack of resources to deal with the heat. But even deeper than that, in cities like ours, the risk of heat and heat waves is actually differential based on the historic kind of inequities and structural racism that we see built into the architecture of our city. When we look at the map of Boston, historically, you can actually look back and see that traditionally red-line districts are now much more urban, more highly populated, and have lower tree density. And a fair amount of climate science research has gone into understanding why trees are so important to cooling off at night. And so regions like Chinatown here and Roxbury and Dorchester are much hotter for much more of the day during heat waves than other kind of wealthier regions of the city. For those who aren't from Boston, those are some of the more urban, poorer regions. And so the actual risk of heat is higher, on compounding the fact that the capacity to deal with that heat is lessened in poor communities. So it's a double whammy.
And we saw sorry, go ahead, Dr. Nguyen.
I was going to say the topic of heat works well because people think of these things as long-term effects. Okay, so the environment, if I pollute, no big deal because I won't be alive to take the consequences. Maybe my grandchildren are. And although that should be enough motivation, often for some people it's too deferred. to make a tangible difference, especially when budgets are tight and there's a lot of conflicting resources. But heat and heat waves, that's sort of like a very tangible now thing, and we Bostonians suffered through some of that last 2 weeks ago, and so people can understand that. And I think if it's tangible and more immediate, I think people are going to make changes more readily.
And we saw these same kind of disparities for people, not just here in Boston, but across the country, across the world, that those marginalized populations were more affected by COVID for many, many reasons. Are there certain groups of patients that you find, either surgical patients or non-surgical, that are more affected by climate change than others? And I know you spoke to the heat waves. I work in pulmonary and critical care now. We actually see, our numbers of COPD and asthma on the rise during these heat waves. What have been your experiences, both, your own clinical experience, but also what about, worldwide outcomes for patients that, that are affected by climate change and disparity?
I can jump in on that one first. This is actually, to take a step back, this is how I got passionate about climate change. So it's a question I really care about. I came at climate change as a medical student, starting to realize that within my clinical practice lifetime, climate change is going to drive disparities in health outcomes. And so this question is something I really believe in. And I break it down in a couple of ways. The climate scientists and kind of climate policymakers would call these two buckets adaptation and mitigation. Adaptation is the ability to adapt or have the resources to ready yourself for the impacts of climate change. And then mitigation is the ability to mitigate or to diminish the way that we contribute to climate change. And so an adaptation would be, building your house on stilts if you're on the coast to ready yourself for sea level rise. Whereas mitigation would be trying to put solar panels on your roof to reduce your use of fossil fuels. And when we look at kind of human capacity across the country, if you come from lower set of resources, from a higher risk community, you probably have less ability to do either of those things. And it ultimately compounds your health risk, is what the data is starting to show. To pull it back to pulmonary, like you were saying, I'm not surprised you're seeing higher levels of COPD and asthma exacerbations. And I'm sure that you're seeing a lot of those patients come from communities of color that are often in areas of heavy industry and are often along major highways. So real sources of air pollution, which is a substrate or a side effect of the same processes that cause climate change, fossil fuel burning. And so as we kind of look more and more across both our nation and then globally, you're going to see more and more examples of how people with low resources are essentially experiencing a threat multiplier effect of not being able to limit their carbon emissions and also, being most at risk and not able to adapt. I think, the pulmonary example is spot on.
Interestingly, I came to the subject of healthcare research through the same way, though not in environmental. So I'm an economist as my side job, as it were. And to me, I study the impact of health on wealth and of wealth on health. So people who have bad health just can't generate income, and they've got, so they slip down that road. Medical bills, high proportion of causes of bankruptcy. And then it's sort of circular, because if you are getting poor, you're getting lower income, losing your jobs because of your health, that impacts the way you can pay for healthcare and pay for appointments to go to healthcare and the rides to get you these things and some of the medications that we have. So it's kind of a vicious circle, the relationship between health and wealth. And so here, with the environment, it's a sort of the same risk factor, in that the environment and negative things about the environment affect people differently, and your ability to recover from that or to mitigate that depends on your wealth. Can you get air conditioning? Can you get out of the city? Can you deal with some of the heat issues, and so forth, and live in a population or a location that's better for your health from the environmental issue. So it very much is all very related, and we again and again see that the same people who are negatively affected by weather, by gun violence, by all these negative things we have in our society and our culture right now, they're the same groups of people, unfortunately. And so it's very additive. It's quite sad, actually.
I think Dr. Nguyen and I both have focused kind of in those answers also pretty domestically on risk factors that we really relate to here in the United States. But I want to call back to you highlighted also, from a global perspective, how does this play a role? And if you back out, and I will put a caveat on this that I am not a global surgery expert, but I have been privileged enough to kind of have some conversations with some people who are really invested in this field. And some of those folks sit on the Lancet and WHO groups that are trying to push for increasing global surgical infrastructure across the world, especially because there are billions of people who simply don't have access to enough surgery or anesthesia care, and it's actually affecting mortality rates in a lot of the developing world. And as we look at the opportunity to expand global surgical infrastructure, it's interesting because a lot of those countries and a lot of those communities are the least culpable, we could say, for climate change. And they are the most in need of increased infrastructure. And with infrastructure, traditionally has come fossil fuels. But we try to reshape this, and we're trying to start to have a conversation about how we could maybe flip the deck, or flip the perspective on that, and have the developing world actually lead and really invest in sustainable infrastructure, both surgically and just more broadly in healthcare, so that as we build up the resources across the world, they actually skip this stage where we're dependent on fossil fuels and we have to rehab our existing infrastructure. Wouldn't it be great if we all decided we were going to invest and actually build sustainably from the get-go and allow them to be global leaders and potentially even economic leaders in the future? It's going to take a lot of upfront investment, and it's going to take a lot of effort from more financially wealthy nations across the world. And I recognize all of the changes and challenges that come with that. But there is a real opportunity in this moment, and if we could seize it.
Great. And to build on that, and I think, we have listeners that are across the globe, and many of them are in healthcare. Many of them are very proactive and leaders of change. What can our listeners do to get involved and to help facilitate this kind of change, at their local level, at a national or even worldwide level? What are some things that they can do to kind of implement these ideas and to help affect these changes in their own clinical setting?
There are a few organizations, both domestically and globally, that I'm aware of, and I'm sure there's more that I'm not. So certainly not to lay favor anywhere specifically. In the U.S., kind of the biggest ones are the Practice Green Health and Healthcare Without Harm are the two largest organizations in this space. And they're not just focused on surgery. It's a broader healthcare set of groups. Although I believe it's Practice Green Health has a specific initiative called Greening the OR. And they produce really surgery-specific guidelines that we've actually reviewed pretty extensively in one of our pieces that are strong and data-driven in terms of how to start tackling these sorts of problems in your hospital. Where is the place that you can start to make a change? More globally, that becomes a bit challenging. There's a group called Build Health International who has some experience building climate-resilient, sustainable hospitals, particularly surgical suites. That are kind of powered by green energy, often solar, sometimes wind. And so they've been a real leader in that space. But as I said, a little less familiar with the global work, but truly there is an opportunity in kind of building up surgical infrastructure globally to be both sustainable and more climate resilient.
I'll add that, most organizations, at least smaller hospitals, don't have an environmental leader. There's facilities, of course, and there's environmental in the sense of, sort of collecting the garbage and the waste and processing and so forth. But some of these forward-thinking projects, there's typically not a leadership, but there is leadership in informatics and other areas, quality safety, of course. So we advocate like having somebody be focused on that. And it's hard because we all do other jobs and so forth and so on. And so we also would say, let's just get educated. And if you ask around, you can put together an interested group in your floor, in your ICU, and your ORs, and kind of work on projects and show everybody that there's an interest and there's things we can do, even if it's a relatively small compared to the larger scale. But that's a kind of a ground up approach. Then hopefully that will garner a lot of attention and people say, yeah, we need to have that as a focus in our organization. Somebody's got to do that, and proactively, not just sort of passively doing these things and so forth, and get ideas and stay up to date. So I think we think of education is probably the biggest one. And hopefully your podcast will get people excited and thinking about it. Number two is a lot of research. I think that the research in healthcare impacts and relationships in environments, I think is not as broad as some of the global environmental research. And then thirdly is the implementation. We think about it. We just don't say you must do this or you're a terrible person. We have to think about it to integrate it into the busy lives and the busy work days of all the people who work in our hospital and our clinics. So there's a lot to do, for sure.
On the implementation front, just colloquially from our own experience or anecdotally, we've actually seen that it's brought a lot of groups together across the hospital that maybe wouldn't otherwise interact or appreciate each other's work, from environmental services and infection control to even, we have OR assistants who are often absolute workhorses of our surgical suite and don't get nearly enough credit for what they do. But everyone has some connection to the climate and to their environment. And so when you start talking about these issues across specialties, you can get nurses, surgeons, anesthesiologists, janitors, OR assistants, everyone in one room aligned on kind of one goal. And one, it's more effective, as Dr. Wynn highlights, because you need a cross-disciplinary team to actually make change in any hospital. And two, it's actually been a pretty feel-good type initiative. So as we gain some smaller wins, we can start tackling bigger sustainability issues.
We come in and we're talking about red bag waste and we want to save the environment, but there's actually people who save the environment every day in our operating room. When I finish the case and I walk out and talk to the family members, I walk back in 30 minutes later and the whole thing is clean, and all the trash is taken out. And we forget, I'm certainly guilty of forgetting all those people who work behind the scenes to make the hospital clean and organize and, all those facilities folks who do all that every day. So as Liz pointed out, it was a very pleasant reminder that we work as a team in the hospital. Every job is important and everybody is critical. It was a really nice discovery and a reminder for me.
Are you starting to see a growing body of evidence of the impact of climate change on patient outcomes? I know, you pick up a journal, most of the, what you read is going to be pharmaceutical, surgical procedure. Are you starting to see kind of a building body of some research and research interest in this area?
Definitely. I think it follows two strains. One is the climate and environmental impacts on health. And then two, even sustainability research, really documenting rigorously how you can reduce your carbon emissions and the associated cost is actually starting to get published in some smaller journals. From a health outcome standpoint, surgery is behind, to be honest. We don't have a lot of literature out there about how the environment impacts surgery. And it's such an important question because, as Dr. Wynn highlighted, there are ways we can manipulate and improve people's environment, artificially, to improve their surgical outcomes. And when you get surgery, you're inherently more vulnerable to your environment than you would be without it. But there are leaders in OBGYN, in pulmonary and critical care, especially, who have really started to look into the impact of various environmental stressors on outcomes. I'm happy to share some links if we're able to at the end of this. But some of the kind of big outcomes that jump to mind is that both pollution and heat at the end of pregnancy have been linked to preterm birth and low birth weight. And it's actually been shown to be higher among African American mothers than any other race. So, I mean, clearly a disparity there. Heat waves alone across the US are shown to increase the risk of mortality on any given day that's a heat wave versus a not heat wave day by like about 4%. And anyone who's in medicine knows that a mortality signal with any risk factor is a pretty major finding. And then in your space and in the pulmonary world, the risk of asthma and the association with pollution is just so clear and well trodden now, especially among kids, that there's ample data out there to show how important it is that we reduce kids, especially exposure to pollution, to improve their asthma health. So there's growing literature, and I'm hoping that surgery is going to jump on board and start doing some of their own research and understanding our role as well.
Well, great. We're running up against our time, but I did want to ask you both, give you both an opportunity, if you had any other kind of take-home points that you wanted our listeners to really kind of take home as their top 2-3 take-home points that they can kind of start to think about and to use as a starting point for their action in climate change and healthcare.
I'll start, Liz, then. I would say, and again, I'll speak for the senior surgeon, someone who's been in practice for a while, setting their ways, as it were. I would say that, the first and foremost thing is that it's not a remote, distant issue. It's an issue that we really should focus on, and it's going to affect you, as eventually we're all patients, if not already, and your loved ones, your family, and your neighbors, and so forth. So I think that that's a part of it. It's something that can be easily dismissed because we're all busy. We've got a lot of stressors in our life, and we get that. And sometimes long-term impacts are harder to understand or to appreciate, but we're trying to show you that it's not just a long-term effect. It's immediate. And I think the second part of it is this sort of tragedy of commons problem where, hey, I'm just this one person, and what I do, how can it make a difference, and how can it make a negative difference in the environment? And while that is true, if everyone thought the same way, obviously we are where we are now. And so you don't need to change the world and eliminate pollution. You just do your thing and help whatever you can. And then if everyone sort of did that, even partially, that would make a huge environment, because otherwise we may never get started, because we would want to wait for somebody else to take care of it for us, which may never happen. So those are kind of my two learning experiences from doing this. I realized that it's not just a theoretical thing that's left for young people to worry about. It's actually relevant for everyone, both as a person and as a physician.
As one of those young people, I think I still qualify as one of the young people, although rapidly aging as residency progresses. I think my two takeaway points are similar and related. One would be that this, as Dr. Nguyen highlights, is not a distant problem, and to connect a lot of the stuff that people are doing in their own personal lives with their healthcare professional lives, because so many of us at home are recycling and turning off our lights and making sure our air conditioning is set to quiet down when we leave, or the heat is we have our thermostat set to save energy. There are ways that you can incorporate that same perspective at work, and I think that that's a really important connection that not everyone makes right off the bat. And then the second component that I would highlight, mostly for people in my position who are coming up in the world, is to not really be afraid of your own agency, or not to underestimate your own agency in this space, because people want to do what's right for their patients, and they will listen to somebody who's even in residency. And surprisingly, there's fairly good social science literature out there to highlight that healthcare providers, all the way from nurses and practice assistants, anyone who's in the clinic setting, all the way up to the attending surgeon at Dr. Nguyen's level, those are some of the most trusted voices on climate change, which, for better or worse, I found surprising, and for better or worse is true, that it's not the policymakers and it's not the politicians, but us in the healthcare industry who actually have the ability to talk to the average citizen about this issue. So even if you think, hey, I'm just a resident, or, I just got out of nursing school and I'm just starting out, you now have the agency to have these kinds of conversations and take that really seriously because you've got the power.
And if they don't believe you, they can just Google it and they'll find on WebMD or another source, right? So, well, I wanted to thank you both. This has been a really great conversation on an incredibly important topic. I think, we have a lot to think about. There's a lot that people can do. And it's nice to have, a problem where people can actually make an impact at even the smallest level. We have so many issues that we hear about these days and people feel a little bit powerless. This is something people can really, impact and change through, just thinking about their practice and thinking about all of the things that you've all, talked about, as simple as, lighting to heating to cooling to, supplies and equipment, but also thinking about our patient outcomes and how can we impact those. What are the things that impact those patient outcomes, and some solutions that are oftentimes quite simple to make that important change. So I'm very appreciative of the work that you do. I'm very appreciative of the time that you've spent with me and our listeners today. We certainly will provide those links to some of the research and to some of the organizations in our show notes. So again, thank you, Dr. Nguyen. Thank you, Dr. Yates, for your time. And thank you, listeners, for spending time with us today. Again, we know there's lots you could be doing, and we're very appreciative that you take that time to learn about something new today. Please make sure to follow us on Instagram at World Extreme Medicine, on Twitter at XpedMed, and visit our website at worldextrememedicine.com. And if you can, and the world allows us to, we hope to have you in Edinburgh, Scotland, November 13th through 15th for the World Extreme Medicine Conference. If you can't join us live, there will be a virtual option as well. Although just Google Edinburgh, Scotland, and you're going to very much want to be there for sure. Especially the two primary things to do are ghost tours and whiskey tastings, and there are ghost tour whiskey tastings as well. So I think that you'd be missing out if you aren't there. So thanks again. And we will see you next time on the World Extreme Medicine Podcast.
Thank you.
Thank you, Stephen.